I will start with a little caveat that if you're a scientist and a purist, then this presentation is probably not for you, because I don't have a lot of data to share with you. What I really want to talk about is how do you actually develop technology, and how do you implement and validate that? So I will talk about what is SEHRA, why we started a SEHRA, how we developed it, and then the implications. And I took the guidance very seriously when they said, talk about your lessons learned and translating evidence into programs. So some of you may be familiar with it, some of you may not be. Why do we need a SEHRA? I won't go through all of this because you're all in the room because you may have an interest in school eye health. But it is quite normal practice in many countries that children have their vision screened in some way or measured in some way at the school. Sometimes it's just a screening test, sometimes a different model where it's a comprehensive eye exam. And it's traditional that these programs are very focused on refractive error for a very long time. And there was a reasoning behind it. A, because it's quite easy to screen for refractive error. You can teach a non-eye health personnel to do it very quickly. And it's also very common in settings where prevalences of uncorrected refractive errors has been high. But what we have also seen is that there's a trend in a lot of regions where I work in sub-Saharan Africa where non-vision impairing conditions that require treatment are presenting in children as well. And that is also something that we need to think about because they require some sort of treatment. And so a few years ago, in the midst of COVID, I came up with an idea to create a tool and develop something called a school eye health rapid assessment. What I wanted to do was create and develop a planning tool that had a module or some sort of component for epidemiological data. So it wasn't just a survey tool to go into schools and measure children's vision or look at what eye health conditions they had. So eye health, as it says, it's not restricted to visual impairment, it's other causes as well. And it's a rapid assessment. It's based on the principles of RAB. So things like it's a restricted population. It's quite a simplified process. If any of you have been using RAB 7, then it's using a software for data entry and analysis. I just want to talk you through a little bit of the journey. This wasn't me sitting in my bedroom during COVID coming up with this. This was a collaborative effort, so it's been a joint consortium, advisory group of a lot of people. Some may be familiar to you on here. And it was a process that took us a very long time. And at the bottom of the slide, you may not be able to see it very clearly, but it was funded by, no longer anymore, but USAID, a Childhood Blindness Program grant. And I applied in 2019 and I got awarded the grant in the middle of COVID. And so all these fantastic plans I had about, getting all these experts in school eye health together and sitting around in a room, around a table and coming up with what we really need did not happen. We did it all on Zoom. So our first meeting on the right there was where we went through that first kind of phase of what should SEHRA have? And the reason I convened this group, you'll see all sorts of people on there. There's funders, there's epidemiologists, there's program implementers, there's policy. So there's all sorts of people in this group. And what I really wanted to create was a tool that was built by consensus. And that takes a lot of time. I don't know how many of you have tried to work on a team where people don't listen. People don't listen or agree with what you want. Gets a bit difficult. So, and you can imagine I had a lot of academics on this team as well who were really clear on what data we should be collecting and how we should be collecting it. So we started designing, developing. We had a lot of advisory group meetings, etc. You can see the timeline there. And then we finally launched this School Eye Health Rapid Assessment in Feb 23 in London. I'm just going to go back to the slide because I want to talk a little bit about what it really means to develop something. When you develop something, it goes through a lot of iterations. Now, when you develop technology, it's quite different. How many of you in the room have worked with software developers? Okay, they speak a very different language from us. Okay, it's like going into a restaurant, not speaking the language, and smiling and pointing at things and hoping you get something you've ordered, okay? Like, it's working with developers really taught me we speak a different language. Like, I would say, I want to make a small change. They would hear it as, this is going to take 3 weeks, and it's an existential crisis for them. So we started having these battles a lot. So if you're ever going to develop a piece of technology, get your developers on your side and try and learn to speak with them, or have someone in the middle. And at Peak, we have something like that now. We have something called a product manager who is able to translate what I want in development speak. So that's one of the pain points of development. So we developed this tool, and I'll now explain to you what this tool is. It has 2 components. And like I said, this is after many, many iterations, many, many pilots. We had pilots in South Africa, in Zambia, in India. We tried to have a pilot in Palestine, but we got blocked because the US government said we couldn't spend their money in Palestine. And so there was a lot of back and forth. And then we finally ended up where we are right now. It's a data-driven tool for school eye health. And what it does, it enhances the planning and delivery of a school eye health program. There's 2 components. There's the scoping module. It's called the Minto module, which is named after, I don't know if any of you who've been around long enough, Hassan Minto was a pioneer of school eye health. He was also my mentor, my guide, who passed away during COVID. So this is a module that's named after him. And what this module does, it's the first step you do. It confirms the essential conditions are in place before you start a school eye health program. And it's got a lot of, I'll show you on the next slide what it contains. And then there's the magnitude module, which is the actual survey part. And what that does, it collects detailed data to address the specific eye health needs among children. And then you put them together and you have the whole tool. So that first part contains things around policy, legislation, human resources, supply chain, barriers, etc. And they fill that in. And then they go on to do the magnitude module, which is detailed data that's collected on school children on a random sample within schools. And so once these 2 are paired together, we can then plan understanding what are the specific needs and school eye health needs of children before you implement a program. I think I'm coming up to my 7 minutes. I'll be quick now. So the 3 kind of big things that I've learned is that there'll be a lot of problems when you develop a tool, especially a digital tool. We're so used to writing in our clinics on paper and going from here to here and then going back here. You can't do that on a digital app. You have to follow a sequence. And each question that you answer then leads to another page. And so what I learned is that developing technology has its own challenges. Not to say that technology is not good, but it comes with a lot more challenge. It breaks a lot. It comes with bugs. Timing is important when you're developing something new. And evidence matters, but there is more to it when planning a program. And so evidence needs to be collected in the right way for it to be useful. If I were to present pages and pages of tables and charts, they're not useful for someone who needs to plan a program. And that technology must be broken before it becomes stable. And I broke it many, many times. And also, if the timing is not right, your solution doesn't matter. So if this, and that's why this whole idea of building something in consensus with an advisory group, a global group of people who had input in every aspect of how it's being developed, it meant that the timing became a lot more. I'm going to stop because I think I'm up to my 8 minutes. Exactly.
Yeah, fine. Thank you. Okay. Our